if I have 3 premature ventricular contractions, it's a quadrigeminy because you start with this. You start with the normal and you count. Now, a premature ventricular contraction can also fool you in the sense that it might look like this as well. No, wait a minute here. Wait. Take a look at this. It's like this is supposed to go how? Right? This is supposed to go up and down, but wait. I see a T, and what the heck is this? This is where students are going to say, wait, is it a P or a T? Is it a P or a T? Don't stress, just relax and take a look. What's happening with the rhythm? P, Q, R, S. So it should be a T, but oh, P, Q, R, S, T. This can also be a premature ventricular contraction. I know what you're thinking. No, it's a bundled branch. Well, you know, it all depends on where it's occurring and how it fits in with the regular rhythm. A bundle branch block, this nice straight QRS, this is a nice one right here, would look like something like this. We're up here and then it's like, oh, and we're going to come back down. This is a bundle branch. This is a bundle branch block, folks. Can it occur a little bit lower, like maybe right about here? Yeah, you know, it might. Typically you see your bundle branch blocks up here. Notice your S and your T are still normal. You got a bundle branch block. Sometimes this will widen the QRS, sometimes not. It all depends. But your premature ventricular contractions are pretty evident. It's just like a drop. Like all of a sudden, everything just kind of, you know, shorts out and it contracts. Okay, prematurely, the ventricles contract. Think about what happens. We already know about blood flow to the heart, right? And it doesn't happen one chamber at a time. It goes together, right? Atria fill. As the atria fills, the right and left atrioventricular valves are closed as the atria is filling. And then as the pressure on the walls of the atria increase, those valves open. The blood flows into the ventricles, right? Once in the ventricles, we've got blood from the right ventricle going through the pulmonary artery to the lungs, blood in the left ventricle pumping out through the right and left semilunar valves, from the left semilunar valve going to the aorta. Think about what's going to happen if those ventricles don't completely fill and contract before they're completely filled. It's going to throw everything off, okay? Because what causes the contraction? The electrical conductivity of the heart, right? So typically, the electroconductivity of the heart without actual heart disease, participating in this is usually the root cause. And by that, I mean you can have a healthy, normal heart, and through medication, shock, possibly maybe loss of blood, loss of electrolytes, an imbalance in your osmolality, all those things can affect the electrical conductivity of the heart and the transmission and permeability of the heart muscle. Certainly with heart disease, It plays a role in a lot of your cardiac abnormalities, such as your ST elevation MI. An ischemic heart will have an area of necrosis, and once that area is deprived of oxygen, the tissue dies. Now, the heart conducts electricity throughout the entire muscle. So of course, when there's no longer any tissue that's viable enough to conduct electricity, you're going to have an abnormal or cardiac lead tracing. Heart block, we know, can sometimes be diagnosed with an EKG, but preliminarily they start with cholesterol levels, HDL, LDL. HDL is good, LDL is bad. Total cholesterol, triglycerides, they do a history, find out, familial history, who passed away from heart, etc. But if somebody's having shortness of breath, maybe some angina, they may suggest that they go for, a heart catheterization. Heart catheterizations can usually determine the blockage and the extent of the blockage and where the blockage is. Sometimes blockage doesn't show up until boom, it hits you. So lots of things can cause this. Let's take a look for a second at this. Torsades De Pointes. This is an interesting rhythm. And when we were taking our ACLS, they gave us this rhythm, the ACLS test. It's so noticeable. It's as if you've got ventricular tachycardia. You've got ventricular tachycardia with ventricular fibrillation all together, and it's twisted about the axis. Okay? So I'm going to stop at Torsades and we'll continue this a little bit later. Torsades De Pointes. It's kind of flipping about the axis. And we'll get some nice examples for you. I think we've got a little bit to work on right now. What I'd like you to do is take a look at the rhythm strips that are in the tutorial. Print them off if you have to, get your calipers, start measuring, and next time we'll take a look at some different kinds of rhythm. And I think I should have like an exit like Mr. Rogers, but it's okay.